The disease I will be explaining today is Fibrodysplasia Ossificans Progressiva, which means soft connective tissue that progressively turns into bone. This is one of the rarest and most disabling genetic conditions known to medicine. There are no other known examples in medicine of one normal organism turning into another. This disorder makes muscle tissue and connective tissue such as tendons and ligaments to be gradually replaced by bone, forming bone outside the skeleton that interferes the user's movement. Any attempt to remove this new bone leads to the growth of even more bone. The ossification from muscle to bone can be triggered by surgeries or even small bumps. This means that doing activities, even simple activities, as a FOP user is really hard. It is severely recommended by doctors not to play sports or proceed with small or big surgeries while being a FOP user. This process of ossification generally starts to be noticed in the early childhood, starting with the neck and shoulders and going down to the body and into the limbs. FOP is congenital, meaning that FOP starts before birth, yet the extra bone does not form before birth. Rather than crawling on their hands and knees, most of the kids with FOP, they scoot on their buttocks and then get up and walk. The reason they cannot crawl is because their joints are not properly formed, so this limits movement. Most individuals with classic FOP have malformation of the great toes, which include shortened toes with malformal metatarsal and a missing abnormal joint, and in about half of the cases the thumbs. These changes in the skeleton can be seen at birth, and they are the first clinical signs of a disorder. Since the disorder is so rare, it is commonly misdiagnosed. About 80% or greater are misdiagnoses, so the toes can be a way to identify it. When the user starts to get older or even during their teenage years, they are most likely to stop moving by themselves. Many of them even lose the ability to talk and even move their hands and legs. Scientists have known for some time that FOP is caused by a faulty gene. This was discovered in April 2016 by an international team of researchers led by Ellen M. Shore, PhD, and Frederick S. Kaplan, MD, of the University of Pennsylvania, published reports of research identifying the genetic mutation that causes FOP. The team found that FOP is caused by a mutation of a gene on chromosome 2 for a receptor in BMP signaling pathway called ACVR1. FOP is inherited as an autosomal dominant trait, which complete pertinence, which means one of the copy of the altered gene in each cell is sufficient to cause the disorder. It can happen that after many families without the disorder, a mutation randomly happened. Then, if the couple decides to have a baby, it has a 50-50% to have FOP. Unfortunately, there is no effective treatment for Fibrodysplasia ossificans progressiva. Surgery is not an option for removing the excess bones because surgery often results in more bone formation, and these new bones don't disappear on their own. Medications are also available to help relieve symptoms of FOP, such as pain and inflammation. On the other hand, researchers are investigating FOP and new treatments. For example, the Oxford University has made research on how to treat and cure this disorder. In a simpler way to explain what they are trying to do, they are creating a drug that asks the protein to stop making damaged muscle into bone. This is such a rare disease that it affects 1 in 2 million people, no ethnic, racial, or gender patterns, and there are about 800 confirmed cases across the globe. what have I learned? The DNA is more important than I thought it is because it has the recipes for the proteins to be created, and the proteins are the ones that make our body work the way it should be.